Hey guys, Dr. Ian here, and today I want to shoot a video on hip health, specifically hip mobility. And the reason why is it's a very common problem I find with my patients is as they age, they begin to lose their hip mobility and those hips just get stiffer and stiffer. And then as we go throughout our day, whether it's walking or bending forward to pick something up, you can injure other parts of your body because your hip's not working properly. And it's a natural part of aging to lose some of that hip mobility. But for most of my patients, I find that it just, they're losing that mobility a little bit quicker than they should, or maybe it's disappearing rapidly because they're sedentary. And it can just cause a lot of problems. It can cause hip pain. But again, it changes the way you move. It can change your gait or the way you walk. It can change the way you bend forward and you pick things up from the ground, the way you pick up your kids or your grandkids. It can lead to some issues. So hip mobility is very important. And there's some easy things you can do to increase your hip mobility and keep your hips as healthy as possible, whether you're young or you're aging. So real quickly, I want to give you an idea of the different motions that the hip does, just to keep it simple. But I think it's kind of confusing when we talk like internal rotation, external rotation. So I'm going to explain what the different movements of the hips for these stretches are, and then I'll show you 4 different stretches that you can do. So if you look at me, if we're talking about my right hip here and the movements it's going to do, I find it easier for people to understand if you just pretend that somebody shot me right in the thigh with an arrow, and that arrow is just sticking straight out towards the camera. Okay, so just imagine there's an arrow sticking out of my thigh. If I take that arrow and I point it away from my body, okay, so now my thigh is rotating that way, and now the arrow is out that way. That is external rotation of the hip. So in other words, it's rotating away from my body. It's external rotation. If I take that arrow that shot me in the thigh and I move it towards my midline or towards my body, that is internal rotation. So when we talk about rotation, don't worry about the rest of the leg. Just think about which way is the thigh going. External rotations that way, internal rotations that way. What I find for most people is they really have a problem with internal rotation versus exterior or external rotation, but both can get limited. And then if we talk about from this plane of movement, this would be flexion. So if my knee is moving forward in front of my body, front F, flexion of the hip. That's how I always describe it to my patients. Front flexion. And then extension of the hip is the knee moving behind my body. So this is extension, this is flexion. Both can get limited. Most people usually lose extension. So extension and extension and internal rotation are the most common losses of range of motion. I'm going to show you some ways to clear up all those ranges of motion in the comfort of your own home, and it only takes a few minutes a day. Alrighty guys, so I'm going to go over a few different things you can do at home to work on that hip mobility that we tend to lose and or that we're lacking. So the first thing I'm going to show you how to do is called a 90-90 position. The reason why they call it that is you're going to put your legs or bend both legs at 90 degrees. So what I'm doing here is my right one is in front of me, my left leg is just to the side of me, and both knees are bent to 90 degrees. Typically, you're going to do this position on both sides, but you want to sit up nice and tall. And so what we can do in this position is we can just kind of explore different ranges of motion. So if you remember the previous video, I talked about external and internal rotation. Right now, I'm getting external rotation out of my right hip, internal rotation of my left hip. And what you can do from this position is you can just kind of work and stretch different positions and just go to that end range where you tighten up and stay there and come out. go back into it. For me, this left hip is really tight in internal rotation. So I do this a lot after I run. I'll just sit while we're watching TV or relaxing. And I'll just, to get that extra internal rotation, like I'm already hitting my end range there. So what I like to do is just kind of lean into that hip, lean back, go as far as I can, and just explore where you're tight and work on those areas, just going into that end range and coming right back out of it, going back into it, come out of it, and just kind of explore where you're tight. Again, this is internal rotation of my left, external of my right, and then you just switch sides. So then we're going to work on the opposite with my right leg and left leg. So that's internal and external rotation, 90-90 position, and you can do it kind of at the same time. You need no equipment. It's easy to do right in front of the TV or whether you're hanging out or whatever you're doing. The next thing I want to show you is hip extension. So if you remember the last video, I talked about how most of my patients lose hip extension. And this is an easy thing to work on as well. So for this one, I would be working extension of my left hip. I'm going to step forward with my right and then just lean as forward with my left hip as far as I can. You'll feel a pull along the front. Don't hurt yourself here and go too hard into it at first. Just get into that end range again and come right back out. Go into end range, come right back out. You can do this 10 to 15 times and relax. You can apply some overpressure from this hand. Come back out. So this looks like a hip flexor stretch, but we're actually trying to get some actual extension into your hip. The last thing you can do to work your hip is, if we have extension, internal and external rotation, the last thing would be flexion. So flexion, again, is bringing your knee in front of your body. You would just bring that hip as far forward as you can, up to your chest. Sometimes people need to bring that knee kind of off to the side and then up, and you're just pulling into your end range again and coming back out. And you can bend this knee if you need to get a little extra motion. Try to not roll your whole torso. Again, you're wanting it to happen in that hip socket to get that deep end range flexion. A lot of times, folks, we just need to take our joints through the ranges of motion that we're not doing on a daily basis. It doesn't have to be complicated. Try the 90-90, do the extensions and the flexions. I think it will help your mobility and your hips out, decrease your pain, and hopefully make your quality of life better. Hope this video helps, and I'll talk to you soon.